passes 4-0. Assemblymember Gloria, welcome.
Thank you, Madam Chair and members of the committee. Before I go any further, I just want to thank you, Madam Chair, for allowing us the opportunity to present AB 2119 with great appreciation to your staff for an excellent analysis that I think provides a really wonderful review of what we're trying to accomplish with this bill. But despite them having prepared that great analysis, let me give you an explanation of what we're trying to achieve this afternoon. AB 2119 builds on the existing foster care system requirements to break down misinformation and stereotypes and ensure that transgender and gender nonconforming youth have access to the care and the support that they need. Now, transgender and gender nonconforming youth are significantly overrepresented in California's foster care system. Current law requires that child welfare agencies assess the health needs of all children in foster care and ensure that they receive appropriate care and timely care to address their needs by qualified professionals. Now, unfortunately, as you might imagine, some personnel, caregivers, and providers may not always provide that kind of access, or at least not culturally competent. This kind of denial of care is really detrimental to these young people, and it subjects them to unstable placements, fewer opportunities to achieve permanency, a lack of access to medically necessary care. The list goes on and on. This is why we're here this afternoon. This bill makes clear that under state law, the obligation to transgender and gender nonconforming youth is written into the law, right? So that child welfare agencies must secure access to clinicians who provide gender-affirming treatment consistent with established standards of care. Now, this is where I want to just take a moment and make sure that we're extremely clear that we are not changing the modes of consent for this kind of care. As is currently the case, many foster children must receive the approval of their parent before they get medically necessary care. This bill would not change that. In the instances where parents are not capable of providing that decision, as many can't today, there are other protocols in place for other family members, social workers, courts, child welfare agencies that can provide those decisions. This would simply align this kind of care with all those other kinds of care that, again, parents can provide consent for or other adults can provide consent for. That just needs to be made really clear on the record, Madam Chair. Now, this need to provide gender-affirming care is urgent. You may not know, so let me try and educate you. I've had to learn a lot myself, that for adolescents in particular, withholding care to this kind of treatment prolongs and really exacerbates gender dysphoria, contributing to various features that are not ideal and provoke abuse and stigmatization of these young people. I think we can all agree that we want to give young people the best start in life possible. We believe by doing this, it gives them a chance to have exactly that. Gender-affirming treatment involves an individualized approach that permits transgender and gender nonconforming youth and young adults to explore and understand their gender identity at their own pace, giving them the room to focus on other important aspects of life that every child wants to or should be doing, which is succeeding in school, building healthy relationships, and fully engaging in the positive youth development programs. AB 2119 will establish that transgender and gender nonconforming youth in foster care, children that all of us collectively have a responsibility for, have access to medically necessary care and treatment for gender dysphoria so that these young people can thrive. This afternoon, Madam Chair, I have two witnesses with me. Dr. Jennifer Hastings, who is the Director of Medical Programming for the Gender Spectrum Organization. Dr. Hastings is on the Medical Advisory Board for UCSF Center of Excellence for Transgender Health. And Dr. Hastings is an assistant clinical professor and an assistant professor for UCSF's Department of Family and Community Medicine. And that was just a fraction of what Dr. Hastings has been up to. Also with us this afternoon is Nathan Glass. Nathan is 17 years old and lives in a group home in Culver City. With your indulgence, we'll turn it over to the witnesses.
Welcome, Dr. Hastings.
Thank you.
Yes, of course. Yes.
Okay, thank you. Well, I've set my timer, so you've read the things I'm doing. So I've been providing gender care intensively since 2003. Supporting appropriate access to gender-affirming care for youth in our foster system will greatly improve the stability and long-term health outcomes for our most vulnerable children. I have supported foster youth who were not able to access care in their own counties. This was never acceptable, and AB 2119 is our opportunity to right a wrong. Withholding appropriate care has worsened mental health, increasing depression, anxiety, and suicidal ideation. In fact, the numbers show that our transgender youth have the highest rate of suicidal ideation and successful suicide. We have evidence that delaying or not providing care is not a neutral act, which you referred to. Suicide and self-harm increase when transgender people are unable to access care. The American Medical Association, the American Psychiatric Association, the American Academy of Pediatrics, and other professional associations recognize that access to gender-affirming treatment, both behavioral health and medical care, is critical to the health and well-being of transgender and gender-expansive people. We are guided by standards of care from the World Professional Association of Transgender Health and the Endocrine Society, which has a clinical practice guideline that was just published 2017, which emphasize, as you did, an individualized approach to care. All youth need and deserve educated, knowledgeable professionals who can support both families and youth. The children of California deserve evidence-based, timely care based on gender-affirming principles. AB 2119 provides needed support for our most vulnerable youth. Thank you.
Thank you. Nathan?
Hi, I'm Nathan. They would introduce me, but I've been in foster care in and out with my family for about 3 years. 2, I've been in this placement, which has been one of the biggest brick walls starting transition as male. Every time I would bring up wanting to start treatment, they would drag their feet and neglect my health rights. It took about a year to finally bring it up to my judge, which was also another brick wall. She wasn't really in support of it the first couple times until I proved that I can make my own decisions and all that. Not being able to access the healthcare that I needed caused a lot of depression and stress, and I felt very unwanted and just all of that. But since getting it, my mental health and everything has improved. I'm a lot happier, and I feel more important and happy that I've gotten access to something that I should have been able to from square one. Yeah, thank you.
Thank you. Okay, do I have any other witnesses in support?
Yes, this is
I'm sorry,
Alex
go ahead.
Chen from the National Center for Lesbian Rights, and we are strongly in support of this bill as being consistent with the best evidence-based practices and standards of care for transgender youth.
Thank you.
Good afternoon, Madam Chair and committee members. Joe Michael for Equality California. We're proud to be a co-sponsor of this bill, obviously in strong support. We'd also like to note this, the support and co-sponsorship of Lambda Legal. They were not able to be here today, and the support of Transgender Law Center. Thank you.
Thank you.
Thank you. Becca Kramer Matter on behalf of the ACLU of California, who are also very pleased to co-sponsor this bill and are obviously here in support, and also speaking on behalf of the LA LGBT Center, which are sponsors and not able to be here.
Thank you.
Melissa Adamson on behalf of the National Center for Youth Law in strong support.
Thank you.
Kathy Sunderling with the County Welfare Directors Association in strong support.
Thank you.
Elizabeth Espinosa on behalf of the Santa Clara County Board of Supervisors in support.
Thank you.
Dante Golden with the California LGBT Health and Human Services Network in strong support.
Alexandre J. Slong, part of Trans Lifeline, in full support.
Thank you.
Lydia Bourne, representing American Academy of Pediatrics, California Division, in support.
Thank you.
Kim Lewis representing the California Coalition for Youth in support.
Thank you.
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Thank you.
Kristen Power, Alliance for Children's Rights in support.
Thank you.
Andrea San Miguel, Planned Parenthood Affiliates of California in support.
Thank you.
Stephanie Ivler, California Alliance of Child and Family Services in support.
Thank you. Do I have any witnesses in opposition? Can you make some room for them, please? Thank you.
So we go sit down. That's fine.
Thank you very much.
Thank you. Thank you for.
Thank you.
Let me start. thank you for this opportunity. My name is Dr. Andre Van Mol. I'm a California family physician and a 9-time foster parent. I also represent the American College of Pediatricians. I'd ask you to oppose this bill. Foster children will be forced into what I call a dangerous protocol that actually lacks proven long-term safety and efficacy for a condition that overwhelmingly goes away on its own. The desistance rate for gender dysphoria is 80 to 95% by adulthood, according to the professional literature. Underlying issues are what first need to be addressed. That's where the state should be putting its money. Those underlying issues can be many, and foster children are more likely to have them. It's exactly because of the kind of family disruption that put them into the system in the first place. There's lots of things that need to be dealt with before a rush. The American Psychological Association's 2014 Handbook on Sexuality and Psychology specifically cautions against what they call a rush to affirm and transition that runs the risk of neglecting individual problems the child might be experiencing. The risks and permanent consequences of a minor undergoing transitioning are sobering, and it makes one a patient for the rest of one's life, and children don't grasp that yet. The long-term benefits and safety for a child undergoing hormonal therapy and surgical transitioning, if they choose to proceed that far, has not been documented. It is impossible to recommend this to minors as evidence-based or safe. The medications involved are not even FDA approved for this use. You've heard mention of WPATH, the World Professional Association for Transgender Health. They specify that to date, no controlled clinical trials of any feminizing or masculinizing hormone regimens have been conducted to evaluate their safety and efficacy. UC San Francisco Center for Excellence of Transgender Health says the impact of puberty blockers administered to transgender youth in early puberty and under 12 also has not been published. Again, these aren't FDA approved for that. And there's a 2011 rather famous Swedish study looking at 30 years of people who have fully transitioned, and they have found that the completed suicide rate is 19 times that of the general population. Clearly something is being missed. Regret is not rare, but what's gone is gone. There's two very left-leaning pro-gay groups, Youth Transcritical Professionals and Fourth Wave Now, that completely oppose transitioning therapy for minors precisely because of the high rates of regret and detransitioning. A child has a developing brain. They yet lack the capacity for full adult decisions and their consequences.
Can you wrap it up, please? You're done the past 2 minutes.
I'm past my 2 minutes.
Yes, and
Thank you
I
very
want to
much
give her an
for your time and
opportunity for her to
attention. I
speak as well.
appreciate it.
Thank you.
Thank you. My name is Evelyn Van Mol. I'm a mom to 4 children, and two of them are former foster children that we've adopted. I've been a pediatric and labor and delivery nurse, and I have many, many friends who are foster parents and professionals who work with the foster children that aren't here today because they're working with them. So I just want to talk to you as a mom. So many of our foster children didn't start life with the necessary bonding and affirmations that from a mother and father since birth. No one looked them in their eye to just tell them how beautiful they are, and the way they're uniquely made expresses itself and how important they are to the world. Instead, they experience neglect and emotional disconnection and emotional, physical, and sexual abuse. They come to us with behaviors that reflect unmet needs and trauma. They have defiance, lying, stealing, hoarding, eating disorders, cutting, promiscuity, suicide attempts, and now we're adding gender confusion, are just behaviors from a child who needs to be loved where they're at, and healing their heart just takes time. We moms let them know they're loved and they're worthy of love. Developing trust with us, it just takes time. Most of the behaviors I mentioned will begin to decrease as trust and connection and healing happens. Gender confusion is a simple behavior to work with as compared to the others. We do our best to protect our foster children from self-harm and from harming others. We lock up our medications and our knives. Feelings of gender confusion aren't harming them, it's not harming anyone else. But this bill is requiring us, foster moms, to lead these children to medications and knives that permanently harm their reproductive systems. Please let us use the time these children are in foster care with us to heal their whole being and to restore trust in relationships. Because they've been violated, it's understandable that these children are not would want to be in a gender other than what their DNA says. But I feel it's not okay to lead them to medications and surgery that will permanently and forever alter their bodies while they're still a child.
Thank you. Any other witnesses in opposition? Please state your name and your organization.
Thanks. Hi, Ken Williams from Bethel Church in Reading, and a church of about 10,000 people every weekend and hundreds of thousands of followers. We strongly oppose this because it's an egregious harm to children that aren't ready to make these kind of decisions, and it's irreversible. Thank you.
Todd Peterson, formerly manager of several outpatient psychiatry and counseling centers. I completely oppose this bill. This is, if passed, it's just legislative child abuse, in my opinion.
Carl Conley, his ministries from Folsom, and I just ask you to vote against this bill.
Thank you.
Good afternoon. Kevin Snyder, Pacific Justice Institute Center for Public Policy. We are in opposition.
Thank you.
Jonathan Keller, President of California Family Council. We obviously are deeply sympathetic and appreciate the Assemblyman's attempts to reach out to foster children, but we are also concerned about the permanent effects of this bill. And the fact that it's irreversible. We would just ask that they consider the impacts this is going to have, especially on faith-based families and their work in the foster system as well. Thank you. We strongly recommend in opposition.
Jean Fisher, I've been a foster mom, and to do this would make it just that much harder to try to be their mom.
I'm her husband, David Fisher, from Castro Valley. We did foster parenting for 15 months. It was extremely difficult trying to correct 17 years that this child was rejected by her mother, and then drug homes, foster homes. We finally were trying to catch her up. And so we strongly object to this bill.
Thank you.
Elizabeth Wanning from Redding, California. Equipped to Love. I strongly oppose this bill.
Thank you. Any other witnesses in opposition? Any questions from the members?
First, I want to thank you for being a foster mother. I think that is one of the greatest things that anybody can do, is to be a foster mother for someone who needs that person in their life. I also want to commend Nathan, who testified earlier, because I think it's so important to see both sides. I think that if someone is asking to just be reaffirmed for who they are, I think it is extremely important that that be provided to them. I earlier heard testimony from a young man who was part of a group called Born Perfect. And I think that for me, that was telling in every way, to remember that every child is born perfect. There were comments regarding irreversible harm. That is one area, certainly I want to know if there is any harm that's going to be imposed on a child. Of course, we would never want that. And I'm certain that Mr. Gloria, whatever comments there are regarding any harm, that would be addressed. But I think the concept of providing services to a youth is extremely important. Thank you.
Any other comments? A question, Assemblymember Gloria, I just want to clarify, because this is an issue for foster kids, and I just want to ask you again what the purpose of the bill is, if you can.
I'd be delighted to. Thank you, Madam Chair. So the bill is intended to specifically make it extremely clear under state law that transgender foster youth transgender and gender nonconforming foster youth have the right to gender-affirming health care. It is added to what is already required or allowed in terms of other kinds of medical necessary procedures or treatments, things of that nature. So we're adding that to it in the same way that other kinds of things. I mean, I've been educated on exactly how far they have to go to get consent to get other kinds of medical procedures, dental visits, things of that nature. This would just add that to those list of things that already are spelled out as being permissible for foster youth, who in this case is a subset of that, the transgender and gender nonconforming youth.
Well, so the way that I read the bill, it says that they have access to behavioral health, which means that they go to counselors. Correct me if I'm wrong, or if you can help me. They can go to a counselor and say, this is what I'm feeling, and the counselor can help them identify if they are truly.
And then access current medical care and current psychological approaches to gender care. So what was quoted by the testimony for folks who are opposed to this bill was actually not current. And we have some good evidence from Holland, and we have studies from 40 years that was working more with an adult population.
Right, no.
Yeah, okay.
So my question is, though, no, but I just want to clarify that this bill is only adding the piece that says that they have access
to behavioral and medical care.
Behavioral and medical care doesn't mean that we're pushing drugs. That doesn't mean, that's my concern, because it was said that we're harming the kids by pushing these drugs. This has nothing to do with the pushing of the drugs. I want to make sure that we're clear on that. This is just giving them access to the health care that they are requesting.
In some cases, it may be appropriate to use medication, but that's absolutely on an individual
after the
case,
behavioral health
after there's been a thorough exploration or understanding of what the youth is expressing,
I think
and allows for
no, as a mother
care.
that you are.
Yes.
I understand the perspective you probably come from on this. This bill would not allow a child to make that decision on their own, and it wouldn't be done, again, without, as I mentioned earlier, without adult consent, and it would not be done absent medical professional involvement.
Which is normal. And I say this because, and I just want to express that we hear both sides, and those of you that emailed and that made phone calls, we heard both sides, but I'm looking at it as a mother, and just today my daughter's sick and I can't be there for her appointment's at 4:15, and I will be here, but the doctor requested a consent form from me so that my sitter can take her to the doctor. And so those rules haven't changed, right? If there's a youth wants to get medical care, the foster family can still has the ability to consent, correct?
Correct.
But this just adds to the existing law. I just want to make sure.
Well, I think Nathan's testimony was telling. We're talking about how he would like to have accessed care, but had to go through multiple hoops that delayed his ability to access that care. This would just spell out very clearly that he has the legal right to access that. But that's not independent. That is, of course, with appropriate adult consent and with medical professionals following established practices and continuums of care.
Thank you. Any other questions from the committee? No? Would you like to close?
I would just close, Madam Chair. Thank you so much for this opportunity. I know your office has put a lot of work into this. I would just say I heard the testimony in opposition. If there's anything you need of our office, we will work with you to make sure that this bill is something that you can stand behind. But with regard to the permanent and irreversible nature of the concerns of those opponents, I would point out that by leaving these children in a state of gender dysphoria without appropriate medical treatment, that is permanent, that is irreversible, and that is what is resulting in the poor outcomes we see for our transgender and gender nonconforming foster care youth. With your I vote today, we can begin the process of stopping that and allowing more of these children to be successful in their lives going forward.
Thank you.
Thank you. I have a motion and a second, and I do have a recommendation that do pass to Assembly Appropriations Committee. Can you call the roll, please?
Rubio?
Aye.
Rubio, aye. Dr. Choi? Arambula? Maienschein? Reyes? Aye. Reyes, aye. Stone? Aye. Stone, aye. Thurmond? Bill has 3 votes, needs 1 more.
Okay, we'll leave the bill is on call, and we'll leave it open for other members to add on. Thank you.
Thank you, Madam Chair.
Thank you. I have Assemblymember Santiago and Assemblymember Carrillo.
me.
We'll go ahead and do Assemblymember Santiago's first.
Thank you, Madam Chair. Judging by the quick first and second, I suspect you want brevity. Absolutely. I'd like to accept the technical and non-substantive committee amendments. And as you know, AB 1862 would appropriate $10 million to CDSS to provide immigration services for those individuals recently affected by the horrible decisions of the Trump administration when it removed its TPS program.
Thank you.
Thank you. Thank you, Madam Chair and members. We are here to co-present AB 1862, a measure that will provide legal assistance to a newly vulnerable segment of our population. As we know, TPS recipients are homeowners. They pay taxes, many of whom have American-born children. It'll be a significant and critical impact to our economy and our state, and we need to, as a state, continue to be the resistance against an administration that continues to attack our communities, both immigrant and undocumented, and very vulnerable populations.
Thank you.
Good afternoon, Madam Chair, members. Martha Guerrero, representing the Los Angeles County Board of Supervisors. Very appreciative of the leadership of Assemblymember Santiago and Carrillo for presenting this important legislation. Out of the county's more than 10 million residents, over 1/3 are immigrant individuals, and an estimated 1 million are undocumented immigrant persons. These individuals and their families largely contribute to the economic and social and cultural well-being in our community. And according to the Center for Migration Studies, 81 to 88% of the labor force participation rate of the TPS population are from Honduras, Haiti, El Salvador, which is well above the rate for the total U.S. population of 63%. Additionally, these individuals have 273,000 U.S. children. In total, there are 325 TPS beneficiaries nationwide, including from the countries of Nepal, Somalia, Sudan, South Sudan, Syria, and Yemen. Many of these individuals and their families have lived in the U.S. for about 20 years. This is now their country, and they call U.S. their home. Therefore, we urge your support for this legislation.
Thank you. Any other witnesses in support?
Rebecca Gonzalez, National Association of Social Workers, California, chapter in support.
Thank you.
Erin Taylor on behalf of the Silicon Valley Community Foundation in strong support. Thank you. Becca Kramer Matter on behalf of the ACLU of California in support.
Thank you. Okay. Any witnesses in opposition? Okay, hearing none, I'll bring it up to the dais. Any questions from the committee members? Yeah. Okay, I have a motion and a second. Would you like to close?
We respectfully ask for an aye vote.
Thank you. Okay, can we call the roll, please?
Rubio? Aye. Rubio, aye. Dr. Choi? Arambula? Maienschein? Reyes? Reyes, aye. Stone? Stone, aye. Thurmond? It has 3-0. It's on call.
Thank you. The bill's on call, and it is recommended. I recommended a do pass as amended to the Assembly Appropriations. We'll leave the roll open for other members to add on. Thank you. And then Assemblymember Carrillo, yes.
Madam Chair, do you want me to stay for the next bill?
For yours.
Okay.
You're already here, so.
Thank you. Much appreciated. All right. Busy day today. Well, again, good afternoon, Madam Chair and members. I'm here to present AB 2872, a bill that would allow the California Department of Social Services to provide justly deserved compensation for providers of in-home support services, or IHSS, who also train their peers. This bill will ensure that those IHSS workers who take their time to train, expand, and enhance this workforce will be justly compensated for their time and their efforts. Currently, the California IHSS program serves over 550,000 recipients with the help of over 460,000 providers. California can expect an additional 26,000 providers to be enrolled in the program by the end of the 2017-18 fiscal year. This means that providers will need to be well trained in order to assist those that they care for and provide their services with dignity. The IHSS program experienced a turnover of 23.6%. Each year, approximately 72,000 providers no longer offer these much needed services. This means that vulnerable populations who depend on this care will not receive it because there will be a shortage of caregivers to look after them. Providers attend to these vulnerable populations in their homes and have little to no way to learn or obtain one-on-one guidance that would help them keep up with the training standards and provide better attention to their charges and those that they care for. AB 2872 will provide much needed assistance in addressing the care and crisis in our state, especially in light of our double aging population, as well as the overall retention challenges experienced by this vital workforce. This bill is supported by IHSS workers who do the job on a day-to-day basis. I ask for your support to ensure that California's IHSS workers receive the recognition and compensation that they deserve. On a personal note, my mother is an IHSS worker, my aunt is an IHSS worker, and the work that they do every day to help those that are most vulnerable in our communities is done with care, with trust, and with love. And we have to make sure that these workers are protected and that they're actually getting paid for the work that they're doing. So with me here today, thank you, is Tiffany Whiten of SEIU California, as well as a home care worker who I will allow to introduce themselves. Thank you.
Thank you.
Thank you so much, Madam Chair and members. Tiffany Whiten with the Service Employees International Union in support and sponsors of this important piece of legislation. The IHSS program experiences, as the Assembly member noted, a lot of turnover, and as the growing population is set to increase, it's important for the providers to get adequate training in order for them to better assist their clients and to help retain providers in the system. This training is aside from what is provided from the public authority or the counties. It's important to note that our members are often asked by the department to provide these trainings on issues such as FLSA overtime implementation or paid sick leave, and have never been compensated for such. So this bill merely allows them to get compensation that they rightfully deserve. And as we all know, a better trained workforce ultimately provides for better service delivery to the client. So with that, I will pass it over to our member from Local 2015 who can better explain.
Thank you.
Yes. Good afternoon, Chair and members of the committee. My name is Carl Vinson. I'm from Solano County, and I'm also a member of a Public Authority Advisory Committee as well, and a member of SEIU Local 2015. A labor union that represents over 375,000 long-term care workers here in California. And I'm from Solano County, and I'm here today to express my support for Assembly Bill 2872 to establish peer-to-peer learning model in the IHSS program. 5 years ago, I became an IHSS provider for a non-family client. And when I first started as a new provider, I found the mandatory IHSS orientation to be informational and useful, but quickly learn how difficult it can be to navigate the IHSS program when I suffered a back injury on the job. I went to the local public authority office to get help